And I believe, if I heard correctly, you were talking about the experience in Hong Kong, and what's happening now with what I understand some are calling the third wave within Hong Kong. But as Mike mentioned, and I have mentioned, that the virus has an opportunity to enter back into a community, if it has the opportunity to find ways to transmit. And I understand within Hong Kong, some of the resurgence that's happening in nursing facilities and in closed settings. And again, unfortunately, we have seen in many countries, when the virus enters a long-term living facility, it could have devastating effects. And in fact, we've just issued some guidance around policies for long-term living facilities to help support countries in trying to prevent the virus from entering into those facilities, and if it does enter, ways in which it can be brought under control very quickly and minimize the devastating impacts that it can have. Having said that, I know we work with many people from Hong Kong, as we do across the world, and you have tremendous experience with infectious diseases, with COVID, with the first SARS, with avian influenza, and I know you can bring this under control. There is no one solution to bringing these outbreaks under control. It's a comprehensive package that needs to be implemented, which starts with finding cases, caring for cases, making sure that they are isolated so that they don't have the ability to pass to another person. It includes comprehensive contact tracing to ensure that any of the contacts are kept away from others, so if they were infected, if they develop disease, if they are infected, they can't pass it to someone else. It includes all of the public health measures, hand hygiene, respiratory etiquette, mask wearing, informing the public, engaging the public. It includes stay-at-home measures when they're put in place. But hopefully, when countries need to implement stay-at-home measures or other types of measures, they're done for a short amount of time, as short as possible, and in the smallest geographic area as possible, so that we can keep economies going. What we're going to have to figure out, and I think what we're all going to have to figure out together, is what our new normal looks like. Our new normal includes physical distancing from others. Our new normal includes wearing masks where appropriate. Our new normal includes us knowing where this virus is each and every day, where we live, where we work, where we want to travel. And that's going to be part of how we move forward with this, finding the balance between keeping the virus transmission low and resuming normal activities. But again, we're defining this together, and Hong Kong will bring this outbreak under control, as they have done in the past.